More than 120 passengers and crew members aboard a Princess Cruises ship have been infected in a norovirus outbreak during a voyage from San Francisco to Canada and Alaska, according to U.S. health officials. The incident has once again raised concerns about the rapid spread of contagious illnesses on cruise ships. The outbreak occurred aboard the Ruby Princess, which was on a 20-day round-trip voyage that departed San Francisco on June 12th. According to the U.S. Centers for Disease Control and Prevention, or CDC, 102 passengers and 23 crew members became infected with norovirus during the journey. The ship was carrying 3,032 passengers and 1,144 crew members. The CDC said the outbreak was officially reported on Saturday, but clarified that those infected were not all ill at the same time. Many passengers had already recovered before the ship returned to San Francisco. Norovirus is one of the most contagious viruses responsible for stomach infections. It spreads easily through contaminated food, water, shared surfaces, or direct contact with an infected person. Because cruise ships bring thousands of people together in enclosed spaces with shared dining areas and facilities, they can be especially vulnerable to outbreaks. People infected with norovirus often experience sudden vomiting, diarrhea, nausea, and stomach cramps. While symptoms usually last between 1 and 3 days, the illness can be more severe for older adults, young children, and people with weakened immune systems or underlying medical conditions. Princess Cruises said its crew responded immediately after the outbreak was detected. Enhanced sanitation measures were introduced across the ship, and the company confirmed that the Ruby Princess would undergo a complete cleaning and disinfection before departing on its next scheduled voyage. The CDC says it is continuing to monitor the cruise line's response and sanitation efforts. So far this year, the agency has recorded 7 illness outbreaks on cruise ships under its jurisdiction, with most linked to norovirus. Health experts recommend washing hands thoroughly with soap and water for at least 20 seconds, particularly before eating and after using the restroom. The CDC also notes that alcohol-based hand sanitizers alone are not very effective against norovirus. The Ruby Princess has a troubled history. In 2020, during the COVID-19 pandemic, the ship became the center of one of Australia's most significant cruise-related outbreaks after returning to Sydney with hundreds of infected passengers. That voyage was linked to 28 deaths, and in 2023, an Australian federal court ruled that Carnival had breached its duty of care by failing to adequately warn passengers about the health risks before departure. As the latest outbreak comes under investigation, health officials continue to monitor the situation closely while the cruise operator works to prevent further infections and reassure future travelers.
If you like this video, then like, share and subscribe to Mirror Now.